Hello friends. I am Dr. Pradeep Mole, interventional radiologist, New Delhi, India. Today I am going to talk about how uterine artery embolization works and indication of UAE. What is uterine fibroid? Uterine fibroid are very common non-cancerous growths in the uterus. Uterine fibroids are the most frequent tumors of the female genital tract. 20 to 40% of women of childbearing age have a fibroid. Fibroids range in size from very tiny to the size of an orange or larger. In some cases, they can cause the uterus to grow to the size of a 5-month pregnancy or more. How non-surgical treatment uterine artery embolization works because of several limitations of surgery like removal of uterus, post-operative discomforts and recurrence after myomectomy. Newer non-surgical techniques have many advantages over open surgeries. It is a non-surgical treatment alternative to myomectomy and hysterectomy called uterine artery fibroid embolization. It is done without any scar in abdomen. It needs just mild sedation. No risk of blood loss or blood transfusion. It can be done in women who experiencing symptoms of uterine fibroids, a desire to retain her uterus, does not desire surgery, poor surgical candidate like obesity, bleeding disorders and anemia. If she is not pregnant. Uterine artery embolization procedure. Uterine fibroid embolization is a non-invasive, non-surgical procedure. This procedure blocks the blood supply of the arteries that supply fibroids, causing them to shrink. Embolization uses angiographic techniques to place a catheter into the uterine arteries so that particles can be injected through catheter and into the blood supply of the fibroids. Indication of uterine artery embolization. Uterine artery embolization is a non-surgical treatment and it can be done in various conditions. Single, multiple uterine fibroids. Focal or diffuse adenomyosis. Recurrence of fibroids after myomectomy. High-risk patient for surgery like obesity, anemia, chronic renal failure etc. Bleeding after delivery. Pre-operative embolization to reduce bleeding during uterine surgery. In all type of fibroids, consider latest non-surgical treatment called uterine artery fibroid embolization. Feedback by 44-year female patient. I met Dr. Pradeep Mole, interventional radiologist, on July 20, 2006 and we discussed my case. He was very thorough and I got a lot of information from him. Even went over my MRI pictures with me. When I asked whether I would be entitled for the medical insurance, he told, why not? He said he would have his staff start working with my insurance company. My insurance was approved in a day and my embolization was scheduled the next day. Everything went off more smoothly and painless than I expected and the next day I was discharged. Now after a week of the embolization, I wonder that I am free of all my symptoms that were so agonizing 1 week back, and that too painlessly and without rendering me immobile even for a day. Thank you for watching. Subscribe the channel to watch more valuable content. Upcoming video. Benefit of uterine artery embolization.